Hey everyone, welcome to COVID Conversations. My name is Laura Lee White, and I'm a health educator with the Central Shenandoah Health District. COVID Conversations is the Health District's COVID 19 education program. This particular video series is in three parts. The first part, we will discuss general information about how to stop the spread of COVID 19. The second part, will discuss quarantine and isolation. And the third part will discuss what you need to know about testing, as well as some other information. Since the start of the pandemic, there has been a lot of information out there about COVID 19, and it's really easy to feel overwhelmed and maybe even experience an information overload. So, my goal with this video series is to provide you with information in a clear and concise manner so that you are empowered to make the healthiest decision for yourself and for our community. This video series will answer the following questions. What is COVID 19 and how is it spread? What can I do to reduce my risk of exposure to COVID 19? What should I do if I get sick? What do I need to do if I have to quarantine? What do I need to do if I have to isolate? Where can I get tested? And finally, how can I help my community, both my campus community and the community at large? So, first, let's start with the basics. What is COVID 19? COVID 19 is a newly identified virus from the coronavirus family. There have been coronaviruses around for a while, and they cause illness in humans, like, for example, the common cold is a type of coronavirus. And they also cause illness in animals. Now, COVID 19 is new because it is believed that the virus spread from an animal to a human. Since humans have never encountered this virus, we have no immunity to it, like some people do with the flu. We have the flu every year, so many people have been exposed to it and built up an immunity. That is not the case with COVID 19. As many of us probably remember, the World Health Organization declared COVID 19 a global pandemic in March of this year. It is important to recognize the symptoms of COVID 19. As we've gone through the pandemic, the symptom list has evolved, and there have been new symptoms that have been identified. Symptoms may appear 2 to 14 days after exposure to the virus. The first identified symptoms were cough, shortness of breath, difficulty breathing, and fever. Then, as we progressed through the pandemic, the symptoms of chills, muscle pain, sore throat, and new loss of taste or smell were also identified. Now, just a note, the new loss of taste or smell seems to be a symptom that can start early on before you recognize any other symptoms and can actually last for a while. Finally, fatigue, nausea, diarrhea, and abdominal pain have also been included in the list of symptoms. Now let's do an experiment to show how COVID 19 is spread. Put your hand in front of your mouth. When you breathe out or say a few words, you will notice that you can feel the air you breathe out on your hand. Maybe you even feel a little dampness. What you are feeling are called respiratory droplets, and it is through those respiratory droplets that COVID 19 is spread. The virus is thought to be spread mainly from person to person, especially between people who are in close contact with one another. These respiratory droplets can be inhaled by someone who is close by, or can land on the nose or mouth of that person, or they can actually settle onto surfaces that are commonly touched. Some recent studies have suggested that COVID 19 may be spread by people who are not even showing symptoms. Those people are called asymptomatic. People who are asymptomatic can be infected with COVID 19 and not have any symptoms at all, but they can still spread the virus without knowing it. It's important to remember that anyone can get COVID 19. The virus does not discriminate against age, sex, gender, race, ethnicity, and socioeconomic status. In most cases, people who are infected with COVID 19 experience mild symptoms and can manage their symptoms at home. But a lot of people are at higher risk for severe illness and even death. This list includes people who are 65 years or older, people who live in a nursing home or long term care facility, people with chronic lung disease or moderate to severe asthma, people who have serious heart conditions, people who are immunocompromised, people with severe obesity, people with diabetes, people with chronic kidney disease undergoing dialysis, people with liver disease, and people who smoke. It's also important to mention that many communities of color have actually been disproportionately affected by COVID 19. We see that African American, Latino, and Native American communities are 4 to 5 times more likely to be hospitalized from COVID 19 than white non Hispanic communities. So, the $1 million question: how do I prevent becoming sick? Well, there is no vaccine to prevent COVID 19 at the moment, and there is no recommended treatment or cure for COVID 19. The best way to prevent illness is to avoid being exposed to the virus in the first place. So let's talk about how to reduce your risk of exposure to COVID 19. This slide explains why wearing a mask is so important. Wearing a mask can significantly reduce your risk of exposure or risk of spreading COVID 19. Remember, in most cases of COVID 19, people who are infected do not start to feel symptoms until much later, about 2 to 14 days after exposure. So they could be spreading the virus without knowing it. Usually, you are contagious about 2 days before you start feeling symptoms. Now, very high risk of exposure to COVID 19 is when you are in close contact, so within 6 feet of someone who is contagious, and both of you are not wearing a mask. High risk of exposure to COVID 19 includes when you are in close contact, so within 6 feet of someone who is contagious, but you are wearing a mask. Medium risk of exposure to COVID 19 includes when the person who is contagious and infected with COVID 19 is wearing a mask and you are in close contact with them, but you are not wearing a mask. Low risk is when both you and the person who is contagious are wearing a mask. This is what everyone should be doing at minimum. Very low risk is when you and the person who is contagious are wearing a mask and are maintaining social distancing by staying 6 feet away from each other. This is what everyone should be doing at the moment. No risk is when you just decide to stay home. That way, you are not even around someone who may be contagious. We should all be trying to stay home as much as we possibly can. It's also worth mentioning that if you don't feel well, then you need to stay home to reduce the risk of exposing other people in public. So, how contagious is COVID 19? Well, here's a great example of how contagious COVID 19 actually is. Now, this outbreak actually happened in Washington state earlier on in the pandemic. There was a choir practice with about 61 people attending it. Among 61 persons who attended the March 10th choir practice, there was one person who was known to be symptomatic, and 53 cases were identified, with 33 cases who were confirmed, meaning that they actually got tested, and 20 who were considered to be probable, meaning that they had symptoms of COVID 19. 3 of the 53 persons who became ill were hospitalized, and unfortunately, 2 died. Now, this was a 2.5 hour singing practice, which provided several opportunities for droplet and fomite transmission. Fomite transmission is when droplets settle onto surfaces that are commonly touched. These members were sitting close to one another, sharing snacks, stacking chairs at the end of the practice, and singing, which would push out air further into the environment. So let's think a little bit about how easy it is to spread COVID 19 in this close congregate situation. We can easily see how, for example, it would be easy to spread COVID 19 at a party where people are close together, aren't wearing masks, and potentially sharing drinks or hooking up. So, before we can get into the nitty gritty about quarantine and isolation, we need to talk about what you can do to avoid exposure to COVID 19 in the first place, since that's the best way to reduce your likelihood of getting sick. So, you need to stay home as much as possible and do not go to social gatherings. Do not invite visitors over to your home, even if it's family or friends. Wear a mask when you are around other people. This is still currently mandated within the Commonwealth of Virginia. Stay at least 6 feet away from other people. Cover your cough and sneezes. Wash your hands often for at least 20 seconds with soap and water. Clean and disinfect frequently touched surfaces daily. And, probably most importantly, if you feel sick or unwell, you need to isolate yourself at home to help reduce the likelihood of spreading the virus to other people. So that concludes part 1 of our video series. If you have any questions, please feel free to email us at cshdinfo@vdh.virginia.gov, or you can call the Central Shenandoah Health District at 540-332-7830. Be sure to also follow the Central Shenandoah Health District on Facebook. There you'll find information about local testing events, as well as more health information about COVID-19. And finally, you can always call the Virginia Department of Health COVID-19 call center hotline. The number is 1-877-275-8348. The next video of our video series will be addressing isolation and quarantine measures that you need to take if you're exposed or if you're sick with COVID-19.